Hey guys, it's Nick. I did my 5-minute video on neuropathy. Let's get started. Just a quick overview and definition of neuropathy. Neuropathy is the dysfunction of the peripheral nervous system that leads to shooting or burning pain. It is often caused by infection, metabolic problems, injury, or toxins. Symptoms include gradual numbness, tingling of the feet or hands, burning or stabbing pain, and extreme sensitivity to touch. Early medications for the pain enables control and prevention of more damage to the peripheral nerves. And this is what we're talking about here. It's just the reduced blood flow and damage to the nerves. Risk for neuropathy, alcohol use and smoking, lack of vitamins, especially B vitamins, kidney or liver disorders. It can be hereditary, family history of neuropathy, diabetes, important one, particularly poor control of blood sugar. And then you have your autoimmune diseases such as lupus or rheumatoid arthritis can cause neuropathy. Essential questions for neuropathy that you want to do during your history taking is type of pain, numbness, tingling, prickling, burning pain, or distal weaknesses. This will help differentiate between sensory motor or autonomic dysfunction. Another question would be symptoms onset, acute, usually consider infections, ischemia, toxin, or trauma. If it's chronic, you want to consider idiopathic or hereditary. Another question would be if it's a certain pattern or for how it's progressing. This will help differentiate between focal, multifocal, or diffuse. The progression will determine if the neuropathy is stable or severe depending on how fast it's progressing. And this is just another picture of just as a monofilament test. We'll talk about that. Physical examinations include deep tendon reflexes is what you're going to do. It's used to reduce, if it's reduced or absent reflexes are associated with neuropathy. You're also going to check muscle strength and tone. Decreased muscle atrophy and weakness of toe extension or finger abduction are often associated with neuropathy. And then you're going to do your sensation testing. Your isolated, reduced pin or terminal sensation suggests neuropathy. This is where you would do your monofilament testing. And common treatment for neuropathy, the main treatment is managing complication, restoring function, reducing the projection of the disease, which will include your foot care, properly fitted footwear, and padded shoes and stockings, glycemic control and vitamin supplementation, which is your blood sugar monitoring, vitamin B supplements. Then you have your pain control, which will include gabapentin, use Lyrica, amitriptyline you're seeing a lot, and then your tramadol is needed for pain, and your lidocaine patches can also be used as well. Teaching components for managing neuropathy, keeping blood pressure and blood sugar under control. Diabetes and high blood pressure increases the probability of neuropathy. Being active through exercise, daily exercise, can keep the blood sugar under control and enhance blood flow to reduce neuropathy. Stop drinking and smoking, plain and simple. Alcohol, drug, and smoking increases the risk for neuropathy. And take care of your feet. Monitor for wounds and blisters to your feet are just good things to teach your patients. And that is my presentation. Here are my references, and thank you for listening.